and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. In our series of transplants, today we discuss lung transplant. It is said that our breathing is a fragile vessel that carries us from birth to death. Such is the functioning of lungs entwined with the human body that malfunctioning of either of the lungs can make survival difficult for a person. Today in Wellness Watch, we discuss lung transplant in detail, how it enables a person with lung diseases to live long and what is needed to keep our lungs healthy. I'm your host, Preeti Kaur. The ability to breathe, something that we often take for granted, is a daily battle for millions suffering from lung diseases. But what causes lung failure? How can we prevent it? And for those at the brink, what does life look like after a transplant? Here's a detailed report by DD India's correspondent Harshita Oberoi.
The lungs, two delicate organs working tirelessly, deliver oxygen and expel carbon dioxide. But when they fail, the body suffocates, not from lack of air, but from an inability to use it. The causes are many: chronic conditions like COPD and pulmonary fibrosis, infections, environmental hazards, and smoking. The warning signs: chronic cough, wheezing, shortness of breath, and unexplained fatigue. Ignoring these symptoms can be fatal. If left untreated, conditions like asthma, chronic obstructive pulmonary disease, pulmonary fibrosis, and lung cancer can destroy lung tissue, making even the simplest act, breathing, an unbearable struggle. For many, medication, inhalers, and lifestyle changes can help. Simple choices: quitting smoking, avoiding pollution, and eating anti inflammatory foods can protect lung infection. Moderate exercise expands lung capacity, while stress reduction practices like meditation and yoga help ease anxiety related breathing issues. But when the damage is severe, these measures are no longer enough. When medication and therapy fail, the only hope left is a lung transplant. This complex surgery, lasting 8 to 12 hours, involves replacing a diseased lung with a healthy one from a donor. The stakes are high, but so are the rewards: a second chance at life. There are three types of lung transplants: single lung transplant for conditions like pulmonary fibrosis, double lung transplant, necessity for cystic fibrosis and severe COPD, heart lung transplant, a rare but life saving option for those with both heart and lung failure. Finding a donor is a race against time. Blood type, lung size, and tissue compatibility must align perfectly. And once a match is found, surgeons work swiftly. The fight doesn't end with the operation. The body may reject the new lung, mistaking it as foreign. Signs of rejection include fever, breathlessness, chest pain. Lifelong immunosuppressants prevent rejection but weaken immunity, making infections a constant threat. In India, lung transplants are still evolving. With a deceased organ donation rate of less than 1 per million, thousands remain in uncertainty. And with costs ranging from 15.5 lakh rupees to 45 lakh rupees, access remains a challenge. But despite these barriers, progress is being made. In 2023 alone, India recorded 197 lung transplants, a sign of growing awareness and medical advancements. Recovery is a long road. Pulmonary rehabilitation helps patients adapt, but survival remains a tough reality. Only 51% make it beyond 5 years. Lung damage is often preventable, but neglect can turn breath into a battle. A transplant may offer a second chance, but prevention is the first step. Stay aware, act early, and breathe easy, because every breath counts. Harshita Oberoi's report, Wellness Watch for DD India.
During a lung transplant, surgeons remove the diseased lung and attach a healthy donor lung to the airway and blood vessels that lead to and from the heart in fact. A lung transplant is reserved for people who have tried medications or other treatments, but their condition has not sufficiently improved. Depending on the patient's medical condition, a lung transplant may involve replacing one of the lungs or both of them. In some situations, the lungs may be transplanted along with the donor heart. Today, we look for the following answers in the show. What is a lung transplant? Who needs a lung transplant? What are the risks associated? How long can a person live with transplanted lungs? And what medical advancements have been made in India with regard to lung transplant? India has become a preferred destination for lung transplant surgery. In India, the success rate of lung transplant surgeries is around 87%. The National Organ and Tissue Transplant Organization, NATO, reported 197 lung transplants in 2021, marking a significant increase. India offers a blend of world-class medical facilities, high-skilled surgeons and cost-effective care. Upon your screens, we'll get to the hospitals and the institutes which cater to the needs for lung transplants. All India Institute of Medical Sciences, Delhi; Postgraduate Institute of Medical Education and Research, Chandigarh; Christian Medical College, Tamil Nadu; Sir Gangaram Hospital, Delhi. To help us understand functioning of the lungs, how important are lungs to the human body, and lung transplant in detail, we're joined in by guests this afternoon. We're joined in by Dr. Vijay Hadda, Professor, Department of Pulmonary Medicine, AIIMS, Delhi. We're also joined in by Dr. Milind Hote, Director, Adult Cardiac Surgery, Fortis Escorts Heart Institute, Delhi. Welcome both of you to the show this afternoon. Dr. Hadda, I would want you to begin this discussion by explaining to our viewers what is lung transplant. Now, we've told our viewers through a detailed report how important lungs are for the human body, but when is it that a person needs a lung transplant? Or to begin with, what is a lung transplant?
See, some things are already been told in the report, that you know lungs are vital to us. Without breathing, we cannot live. So once the lungs stop functioning, basically lung function is we take air inside, and from air lungs extract oxygen and it is distributed to the blood, and once it to blood, it's circulated to the rest of the body. So basically you see that oxygenation of the whole of our body is dependent on the proper lung functioning. So once this function is disturbed, it can be because of airway diseases. For example, is shown in the report that COPD. COPD is very common. Yes. Is a disease which is caused by smoking. So in that also there is a problem with the oxygenation. Similarly, there is another disease entity called as pulmonary fibrosis, which most of the time the lay person will call ILD, or we also call it ILD. That is the second most common cause of the lung failure. Then there is one disease which is commonly affecting children, although that disease entity is not common in India, cystic fibrosis, related bronchiectasis. So in India, instead of cystic fibrosis, there are other causes of bronchiectasis which can also lead to lung failure, which may require lung transplant. And then there are certain conditions where the heart disease is also there, and because of that lung is also diseased. In that condition, we usually go for heart and lung transplant. So commonly the COPD, bronchiectasis and ILD, these are three most common conditions where lung transplants are required. In this operation, basically what we do is we remove the diseased lung from the diseased person, and we replace it with a newly relatively healthy lung. So this is in nutshell what is lung transplant.
All right, I'll take that forward to Dr. Hote. Dr. Hote, sir explained to us what is a lung transplant and the conditions he explained to us, but I would want you to tell us what types of lung transplants are there.
Yeah. So essentially, as Dr. Vijay said, we can have a lung transplant for specific conditions, disease conditions, and the types, important types are the single lung transplant and the double lung transplant. So if a person has disease which is, let's say, relatively confined to one side, or a situation wherein if we replace one of the lungs, the new lung can compensate for the diseased lung and can handle the requirement of the respiration in that person, we consider for a single lung transplant. However, I must add in a note that single lung transplants are going down in numbers nowadays. More and more so, both the lungs are being transplanted in most of the centers across the world. That is so because it has been clearly observed that transplanting both the lungs in a person definitely improves the longevity of the person much more than doing a single lung transplant. In some patients, if the patient has got both heart as well as the lung problems, then we can consider a heart lung transplant. So, essentially there are three types: single lung transplant, double lung transplant and a heart lung transplant. Most common of them is a double lung transplant.
All right, Dr. Hadda, what are the early symptoms that a person looks for if the lungs are malfunctioning? Is there a particular age criteria for a person, for the lungs of a person to start malfunctioning?
Not exactly. As I told, there are certain diseases which will affect the young population. There are certain diseases which affect the elderly population. So, if patient is having, let us say, COPD, those people will be usually more than 50 years, and because every disease has a treatment also, so we keep on giving treatment, and with the treatment we assume that chances of progression to respiratory failure will be less. So, maybe let us say one patient develops COPD at the age of 50 years, we start treatment and we can delay the onset of respiratory failure. So, most of the time these patients, if require lung transplant, most of these patients will be in, let us say, 60s or maybe 55, 60 years. But there are certain conditions, for example, congenital diseases, genetic disease, emphysema. So, if somebody is having alpha-1 antitrypsin deficiency, they will require probably at earlier age. Similarly, if patient is having cystic fibrosis, they will also be young age. So, it all depends what are the underlying cause which have led to respiratory failure or what is the indication of lung transplant. So, the age will determine that. The second important part is, for example, in ILDs, so we give treatment and we try to stop again the progression. So, usually unless patient met certain criteria, for example, patient has already went on to requirement of oxygen, in that case we assume that once patient is on oxygen, chances of recovery are very bleak. In my experience, if patient is on oxygen for, let us say, for few months, there are very little chance that this patient will be survive without oxygen. So, this patient clearly indicate lung transplant. Similarly, in COPD patients, again the COPD is one disease where management is so good that we can delay the lung transplant to very late. But in ILDs, especially idiopathic pulmonary fibrosis or IPF, as soon as patient is being diagnosed, we ask the patient, please be prepared that you may require lung transplant. So, in nutshell, the age when the patient will require a lung transplant will largely depend on what is the underlying condition for which he is requiring lung transplant.
And if a person undergoes a lung transplant, what are the chances of the original lung disease returning to the person after having a lung transplant? Does that really happen?
Yeah, very interesting question, and most of the patient will ask this. So, there is enough data which suggests that once we remove the diseased lung, and what is the chance of this?
Yes.
Almost negligible. So, there are certain conditions, for example, the connective tissue disease. Suppose somebody is having scleroderma, which is a condition which lead to lung fibrosis, skin thickening and other problems. If we do a lung transplant in that case, then one will assume that because of scleroderma, the second lung will also be affected. But practically this has been not observed. There may be multiple causes for this, we will not go into that. But once we have removed the lung, we have changed the lung, the chances of recurrence of same disease in the new lungs are basically negligible, although it can happen, but they are not a major concern for the transplant physician or transplant surgeons.
Dr. Hote, for how long can a person survive after a lung transplant?
Yeah. So, just a little bit of history regarding this. The first one was done almost 60 years back,
Yes.
1963. The science was a bit, in the initial stages then, and the medicines also were not so good. So, over the next 20 or 30 odd years, the enthusiasm for lung transplant was not very high. But now with in the recent times, in the last 15-20 years, the survival has improved drastically, and 1 year survival is almost 70 to 80%. And in many of the advanced and experienced centers across the globe, the means you can say even 20-year survival is more than 25%. So, patients who undergo a lung transplant can definitely look forward to having an active and healthy life.
Can a person
Post-transplant.
can a person after having a lung transplant,
Yeah.
is there a need for him to have another lung transplant during the rest of his course of life?
It is rare, but yes, that is possible. What may happen is that after a lung transplant, the patients are placed on some medications, immunosuppressive medications, and some degree of immunological reaction may occur in spite of the immunosuppressive medications, and maybe in 10 to 20% of the patients you can have some degree of damage to the newly transplanted lungs, and over a course of maybe 5 years or 10 years or 15 years, the newly transplanted lungs may deteriorate to some extent and may require a retransplant, but that is very rare.
So for a person to get a lung transplant, awareness is very important. From you, I want to understand, Dr. Hadda, what is the frequency of lung transplants that is conducted in India, and is there a need for social awareness for the people with regard to lung transplant?
Yeah, it's very important question. So it depends where we are practicing. For example, in our institute, I am running a clinic where we see lots of ILD patients, and ILD is one disease where treatment is not so advanced. Most of patients, despite best of our effort, best of medication, the disease keep on progressing. So these patients, once they come to my clinic, I will start talking at least that this is a disease where whatever I do, there are chances that the disease will progress. And one option may be the lung transplant. Similarly, I think the rest of the pulmonologists or respiratory physicians, wherever they are practicing, so there are certain diseases where the disease keep on progressing despite treatment. So those patients, they should be counseled at least at the first contact that you are having this disease and you may require a lung transplant in the future, not today, but at least please make up your mind. And if the physician think that this patient may require lung transplant next few months to few years, then the patient should be referred to a center which is running a active lung transplant program. So that is one thing. Many times we are receiving a patient who already having so advanced disease that they are bed bound and they are not unable to even perform a active physiotherapy.
Right.
So their functional status is so poor that even if you perform a lung transplant, investing so much money, energy and everything, the outcome may not be so good. So that's why I am telling that as soon as you identify that this disease may require lung transplant, the time is very crucial. So you prime the patient that you may need lung transplant and you start physiotherapy at that point of time itself. Because you need to understand patient perspective also. If I say that you will require a lung transplant, which is costly affair, it may require many lakhs rupees.
Right.
So he may need some time to arrange that money.
Yes.
He also needs some time to make up her mind or his mind that what will happen after lung transplant. So for this, everybody require time. So at the first go itself, if we start explaining to the patient, then many of these hurdles can be overcome.
All right. Dr. Hote, to lead a healthy life, healthy and robust lungs are very important. For a person, who assumes that he is healthy at the time being, are there any symptoms that a person should look for? And also, as Sir told us about, lung transplants are done on basis on the condition of the lungs. So when is it that a normal healthy person should think that he might be heading towards a lung disease in the near future, given the way the city life we are living in, the atmosphere and the pollution which we have to brave every day? Put all this together, when is it that a normal healthy person who assumes that he does not have a lung disease, how does he progress?
So this is more of a physician's question, but I will I'll present my insight into that. So there are, let's say there are 100 people living in a city or any place, and maybe about 20 odd people might have some respiratory symptoms, initial respiratory symptoms. Rest 80 odd may have very episodic or minor symptoms who do not need to really think about any such thing possibility like a lung transplant. So out of the 20 odd people who have some recurrent symptoms, let's say of cough or breathlessness, or maybe getting up in the night because of dyspnea, means because of difficulty in breathing, they obviously need to see a chest physician, and the physician would do some tests like X-ray or maybe a CT scan and things like that. And if the physician diagnoses a condition which might tend to show that it will progress, so in that situation the possibility of considering a lung transplant is only to be done. However, most of the people, as I said, do not really need to think, or they will need a lung transplant.
All right. Yes, please add to it,
So
sir.
I can add little bit. So see, healthy people will not require lung transplant. It may be a situation that healthy patient develops some acute infection, for example influenza, and he went into development of ARDS. And the ARDS is so severe that it damages the lungs. So that is the only situation where relatively asymptomatic person may progress so fast that he will require lung transplant. Otherwise, asymptomatic person will not require lung transplant at all.
All right. I would also want you to apprise our viewers with the medical advancements that have been made in India and also worldwide. What progress has been made when we talk of medical research on lung transplants? There is the new 3D lung model advances that have been made. Added to that, what is it that the medical fraternity is working on when we talk of lung transplants?
I think I will not go into deep of it, but the most important thing for the listener is that if we compare today to last few decades, the more and more centers are performing the lung transplant program. They are running lung transplant program, and there are many public hospitals which are coming. For example, at AIIMS we performed almost 3 years ago. So Vijay Chandigarh is also performing.
Yes.
So there are few public hospitals which are coming forward to do lung transplant. And the other things is there are some advancement. One thing was, once we retrieve the lungs from the cadaver or the donor, the time for which the lung can be stored before the lung transplant is very short. But there are few techniques which are coming in pipeline that we can keep that lung little longer time. So this is one advancement. That's the second thing is the availability of ECMO, which have made life little bit more stable. Means we can buy little more time. For example, lung has failed, so we can keep on oxygenating lungs with the help of the ECMO, and then the patient can be taken up later on for the lung transplant. So there are 2-3 things which I remember in this field.
Sir, you would add to it? The medical advancements that have been made?
Yeah, as Dr. Vijay said, we have a special technology now available. As of now, it's yet to come to India, but some centers have used it on an episodic basis. It is called the ex vivo lung perfusion. You remove the deceased donor's lungs, and if you think, and if the surgical team thinks that the lungs that have been removed are a bit compromised, then we can place these lungs on that machine device. It in a way, let's say, treats the lungs for maybe 5 to 6 hours, and we do further tests on this these lungs, and once they show some improvement, we can think of transplanting those lungs into a patient. So that is called ex vivo lung perfusion. And then there are some new surgical techniques also. We can use mismatched lungs, bigger size lungs into smaller patients, and these advancements are rapidly coming up.
All right, very quickly to close the discussion, what are the risk factors that are associated with lung transplant, sir?
So I think most important is because we give lots of drug which knock out the immunity. So that is, I think, most important risk, that patient may develop infection which usually don't happen in a general healthy people.
Okay. So that was the discussion on lung transplants today. But for our viewers to get more insights, we'll have a quick mythbuster round, and where we'll have quick rapid fire questions to our guests who are there in the studio with us. Dr. Hote, lung transplants guarantee a short survival, is it so?
No. Lung transplants, many patients have survived for more than 10 years, 15 years, and even 20 years they have survived.
2 lungs are way better than 1, is it so, Dr. Hadda?
Yes, and there is enough data which suggests that 2 lungs are better than 1, and sometimes we can do 1 also, but mostly 2 lungs are better.
Dr. Hote, lung transplant is a quick fix, is it so?
It is not a quick fix, it is the end solution to be considered only in patients who are very well motivated and fit enough to undergo lung transplant. Prior to that, all medical therapy should be considered.
Dr. Hadda, are lungs the hardest part to transplant? If so, why?
Yes, because the lungs are totally open to the environment. So anything in the environment will enter in the lung, and they can cause damage to that. For example, infections.
A person cannot get lung disease if he does not smoke. Is it so, Dr. Hote?
No, that is not true. There are many genetic conditions also that can lead to lung problems, and pollution also can lead to lung problems.
Can the entire lung of a person be donated in one go, Dr. Hadda?
Yes, usually we take the full lung whenever there is a donor.
All right, so that sums up the discussion on lung transplant today in Wellness Watch. Thank you so much, both of you, for joining us this afternoon on Wellness Watch and throwing more light for our viewers to understand how important lungs are for the human body, and also helping us understand lung transplant better. And lung transplantation is a crucial treatment option for individuals with end-stage lung disease, offering a chance for survival and improved quality of life when other treatments fail. But it is important to note that it is not a cure. For a person to live long and healthy, lungs have to be equally healthy and robust. After all, Bart Millard rightly said that as long as there is breath in our lungs, our story is still being written, isn't it? On that note, we'll end this edition of Wellness Watch. Till we meet next, take good care of yourselves. Bye-bye.